No, I am. All right, so pulse. We talked about temperature, and let's talk about pulse and respirations today. So it's abbreviated P. You guys already know that. I think that was on your payday. And it's the number of complete heart in 1 minute. So whenever you look at that number, like somebody's pulse is 70, that means it's beating 70 times every minute. And so your pulse tells you kind of how much blood is being pumped, or it gives you what we call like cardiac output is one of the terms that we'll use for that. It's how much blood versus and plus, or times the heart rate. So that tells us how much blood is being pumped and how well blood is being pumped in your body. One really good thing about pulse, specifically the assessment pulse, is that it's really sensitive to changes in your body. So, you get an infection, it makes your heart rate go up. You get fever, it makes your heart rate go up. You get stressed, it makes your heart rate go up. So there's lots of different things. If you have any kind of abnormality going on in your body, a lot of times it's reflected in your heart rate. So it's really sensitive to that. So it tells us, it can tell us if something's going on. Excuse me. So whenever you assess and document the pulse, you're going to do heart rate, of course, the rate, the beats per minute. You're going to write down where you take their pulse, kind of like we do with the temperature, the rhythm, the volume, and then bilateral presence. And we'll talk about those specifically in a minute. So you can assess this by palpation or auscultation. And palpation is the process of just like feeling to assess, like you feel for a pulse, or, like if somebody, let's say they come in and they have their leg is swollen, you mash around on it to see what's going on. That's called palpation. That's basically like using your hands to assess, somebody or something. Auscultation is listening to assess, like you put in a stethoscope and you listen to their heartbeat, or you listen to their lung sounds. So that's auscultation. Okay, so those are two important words to know. We'll also talk about observation, which is where you just use your eyes to look and assess. And I guess that's probably it. So some abnormalities we might expect to see with pulse. Tachycardia. What is tachycardia?
Fast heart.
Fast, good. So tachy, remember if you get dressed too fast, then you look tacky. So tachycardia, okay, is your heart rate that's too fast. It's faster than normal. Bradycardia is what?
Slow heart.
Good, slow. So Brady is slow, so it's a slow heartbeat. It means it's too low. Arrhythmia or dysrhythmia, remember A means not or without, and then dys means bad or like it's, difficult. So arrhythmia is like what it sounds. It doesn't have a rhythm. So, your heartbeat, if you listen to it, it normally has like a paced rhythm to it. Okay. But somebody who has an arrhythmia or a dysrhythmia, it won't have that steady pace. It's kind of like it's like when people clap off beat, and it sounds really crazy. Okay, it's kind of that same idea. So your heart rate should have a normal, steady pace. But when you have an arrhythmia, it makes it jump around. Maybe it beats too fast, or it just beats off. So that can be an example. Decreased circulation, of course, is another abnormality. So maybe your heart is pumping the way it needs to, but maybe it's not perfusing to all of the blood vessels in your body. So, those areas do that. If one way to assess that, and you guys can do this at your seats, you might not be able to do it with the lights off, but is if you kind of take your fingernails and you mash on them with your other finger, they'll turn white. That's called blanching. They should return back to normal within like 2 seconds. Okay, so they should, like if you mash on your fingernail, it should go back to being pink within just a couple of seconds. Sometimes if somebody's having low oxygen problems, or if they're having, don't have enough oxygen, they've got some other kind of circulation issue, that it might take it several seconds to go back to being pink. And I know that sounds like a silly assessment, but it's called capillary refill. And it's just, how fast does your blood kind of refill in those areas where you've kind of obliterated it. So anyway, so that's another side assessment that can be done. Okay, so sites where we take the pulse. Radial is the first one on here because that's probably the most common. Excuse me. So your radial artery is right here. Anywhere on their body where you feel pulses, that means there's an artery there, because arteries is what carries that pulse. So the best way to find your radial artery, and we'll go over this again tomorrow while I'm there, but in case you guys are just wanting to know, you'll take your fingers, and if you kind of run them down the side, like underneath your thumb, straight down your arm, there's like a little gap or like a little crater type area where the tendons make, along with your radius in your wrist, and you can usually find your pulse right there. Go straight down from your thumb down to your forearm. It's right in there. Usually pretty easy to find as long as you stick to that thumb side. Now, the one way to remember where that is that your radius is always, the bones in your forearm kind of twist over each other, but the bone that's connected to your thumb, your forearm bone that's connected to your thumb, is always your radius. So it's always that side. So that's the easiest place to find your pulse, is the thumb side of your wrist. Okay. The carotid artery is up here in your neck, and that one's usually pretty easy to find. It's important that you don't try to find your pulse, like the carotid pulse, on both sides at the same time. Okay, because if you press too hard, you can obliterate that, and then you're not going to get enough blood to your brain for a little while. We don't want that. So, but your carotid artery is usually pretty easy to find. You guys can probably find it pretty quickly. Excuse me. The brachial pulse is your arm. Remember, brachii is arm. You don't want to break your arm, so brachial is arm. And this one is kind of at the inside of your elbow. And we'll specifically find the brachial pulse whenever we start taking blood pressure. So that's one that you'll have to get used to. Apical, this one's not listed over here, but apical pulse is at the chest. And you can listen to an apical pulse with the stethoscope. So that's the one that's there at the chest. And we'll talk about that too, because we'll get out the stethoscopes and listen to them. Your temporal pulse is up here at your temple. You guys have probably felt that one before too. It's pretty easy to find. Your temporal, the reason it's called that, is you have a temporal bone that kind of goes over your ear. That's part of your skull. And then you have your temporal lobe of your brain. It's on the sides also. Femoral, this is at the groin, kind of where your trunk and your leg meets. That one is a central pulse, so that one's usually one of the last ones. If, something's going on, somebody's gone into shock or something, that's one of the last pulses that would go away. It's usually a pretty strong pulse. Popliteal is right behind the knee. This one to me is the most difficult to find. And then the last two are on your feet. Dorsalis pedis is like right on top of your foot. Actually, if you take your fingers and you kind of find the space between your first and second toe, and you just go straight up your foot to the very top of your foot, that's usually where you'll see that dorsalis pedis, feel that dorsalis pedis pulse. And then the posterior tibial one is right behind your inner ankle bone. It's right behind that, kind of up above it. These two are really important. Obviously, you're not gonna check somebody's pulse in their foot for a whole minute, but it's really important. Like if somebody's had some kind of leg surgery, or if they've been immobile for a long time, those are really good pulses to check, just to make sure that they're getting blood flow to their lower limbs. So even though you're not necessarily going to check, a pulse for a whole minute, those are still really important to be able to find and assess, so that if the person has good perfusion or not. Okay, characteristics of the pulse. So the first one is the rate. And of course, beats per minute. So how many times is their heart beating in 1 minute? Whenever you listen with a stethoscope, there's actually two sounds that your heart will make. It's like lub dub, lub dub. And you'll hear that. And each one, like each full beat is just considered one. You don't necessarily count both of the sounds that are within that same beat. So generally speaking, we'll measure it over 30 seconds and then multiply it by 2 to get the beats per minute. Now I know at the Pro Museum the other day. She did it for like 15 seconds, I think. I would really suggest doing at least 30, and here's why. 15 seconds is not very long to miss one, right? The other thing is 15 seconds is not very long to hear if something is irregular. It's kind of hard to know that when you've only listened for 15 seconds. So I think it's important. And in here, we're going to listen to 30 seconds and then just multiply it by 2 to get the beats per minute. Okay, so for example, if the patient's heart beats 40 times in 30 seconds, then you do 40 times 2, and their heart rate is actually 80. Same thing. 30 seconds and you count 54 beats, then what would their heart rate be? What's 54 times 2?
108.
108, okay, which is a little high. So check a patient's pulse for 30 seconds and you get 30 beats. What's their heart rate?
60.
60, okay. So very easy to do that way, and that eliminates some error too, just in the multiplication. All right, so expected pulse rates. Look at how high a newborn's heart rates are. Okay, so we've got, they're way up there, and this is normal, okay? And they seem to get lower the older we get. Our heart rate gets lower and lower and lower. Other things that can affect pulse, male versus female. I think females' pulses are usually a little bit higher than males. Fitness level, usually the more fit you are, the lower your heart rate, the lower your resting heart rate. And then, of course, illness usually makes it go up because any kind of stress or infection, anything like that makes your heart rate go up. Fever is another thing. That's one way I can sometimes tell if my kids have fever. If I'm not really sure, I can't tell if they're really that warm or not. I can tell if their heart's just like beating out of their chest, like I can feel it or hear it, then I know that they probably do have fever. Okay, the rhythm. So this gives you a pattern of their heartbeats, kind of like I said earlier. It has to do with that, like an arrhythmia or a dysrhythmia. That's what you're looking for here. So it should be regular with paced beats, okay? Should be pretty regular. But sometimes it can be irregular and still be normal. It kind of depends on their history. But if you notice that something is irregular about it, if you notice that it's not really beating quite at the same pace, for that 30 seconds, then you need to go ahead and get out a stethoscope and listen to it for a whole minute. And then whenever you document it, you just document it as irregular or irregular. You can't really diagnose them with a dysrhythmia or anything like that until, one, a physician has to do that. And secondly, they would have to get an EKG to see what's going on. All right, volume. So volume tells you strength. It's like how strong is the pulse itself. So you assess this by palpating it again, and you just feel, how strong is it beating whenever I've got my hand on it or my fingers on it. So there's 4 kind of documentation marks you can make. Obviously, if it's 0, then it's not there at all. Then you've got more issues. And so +1 is the next one up, and you can document it with these numbers. Okay. So that means it's thready or weak. Thready is a word we usually use for like a weak pulse, which means it's kind of hard to find maybe, but it's there. You can barely feel it. And look, it's easily obliterated by light pressure. That means if you barely press on it, you actually make it stop. Like you collapse the artery and make it quit pushing blood through. So that's +1. +2 is kind of like your normal pulse. That's what most people's heart rate is going to be at rest, is +2. It's strong, it's pretty easily found, and it's obliterated by strong pressure. So if I put a whole lot of pressure on that artery, then the pulse will go away. It closes it off. And then the last one is +3, or bounding, or full. Means it's like, maybe it's like, feels like it's beating out of their chest, or if you can see like their neck pulsing or their wrist pulsing or temple or something like that. That's bounding. It's really difficult to obliterate. Even if you press hard on it, it doesn't necessarily stop it from beating. Okay, then bilateral presence is the last little characteristic for pulse. And this just means, remember, bilateral. Bi means what? Two or both. And lateral means side, like right underneath the word here. So bilateral, both sides. So this just means that you're assessing it on both sides. So if I check their radial pulse on one side, I check the other one at the same time. You don't have to count it. This isn't a time when you have to count it for a minute or 30 seconds. You're just feeling to make sure they're both beating at the same time. You know, they're both present and so forth. You just want to make sure that, you know, there's nothing weird going on between both sides of their body. And so you'll look and just make sure that they're equal. And you can just put, you know, bilaterally equal or bilaterally +2. Sometimes I'll say that. So when you document it, you include all of those things: the rate, you know, your beats per minute, rhythm, volume, and bilateral presence. So I've put in an example here. So radial pulse is 60, it's regular, and +2 bilaterally. That means it's +2, it's normal, strong pulse on both sides. Okay, the procedure, we talked about this a little bit, and we will do this some more tomorrow, but just a couple things I want to go over in case you guys try to get started on that today, because you can go to this page in the blue book and find the procedure. They need to be sitting and comfortable. Okay, if they're up walking around, their pulse rate, you know, it's going to be higher. Use 2 or 3 fingers, like your first 2 to 3 fingers. Don't use your thumb. Does anybody know why?
No, you killed you have a vein in your thumb. Yeah.
Do what?
You have like your pulse in your thumb.
Yes, you have a pulse in your thumb. So if you check someone else's pulse with your thumb, you may actually be feeling your own instead of theirs. Okay, so yes, definitely don't want to use your thumb to do that. Radial pulse is used most commonly, and I just told you how to find that, and then count again for a full minute if it's irregular. For apical pulse, make sure that this is a good one to use for infants and children. Infants are, you just can't hardly find a radial pulse on an infant because their limbs are like so round. I mean, they're usually pretty chunky. And even their wrists and stuff, they're kind of like little circles. I don't know, I guess that's just the way babies are shaped. But so those are usually kind of hard to find. The easiest ones to find on a baby is the femoral pulse, the one at the groin, and then the brachial pulse. But the brachial pulse is not at the elbow for babies. You don't check it there. You check it kind of underneath their bicep. So really the easiest way is to just do an apical and listen to them, listen to their heart rate with the stethoscope. So apical pulses are used for infants, children, people with cardiovascular diseases. So if they already have something going on, we know that we need to listen. Or again, if you find an irregular peripheral pulse. Does everybody know what the word peripheral means?
Like slide.
Yeah, like your peripheral vision. Okay, it's kind of out from the center. Okay, so your central pulses are like your femoral pulse. It's at the groin. Your apical pulse, carotid would be a central pulse. Those are kind of central to the body versus your peripheral pulses, which are the ones that are on your arms and legs. Okay. Of course, you'll need a stethoscope to auscultate the pulse. It's usually found just below the breast. It's usually done best. That's why the doctor does this on bare skin, because they can hear the best. There's not, clothing sometimes can make like a scratchy kind of sound maybe. Obviously in class, that's not what we're going to do. But we will practice all of this whenever I get back tomorrow. So. And then just read the directions carefully. This is on that same page, or right close to that same page where the other procedure was. And we'll talk about how to use the stethoscope tomorrow too, when I can show it to you. Okay, we'll talk about respirations for a few minutes. So what time it is? I think I can get through this before you guys go to lunch. Go to fifth period. Respirations are abbreviated R or RR. So R is for respirations. I think we had that maybe last week on our payday or this week. RR is respiratory rate. And they really mean the same thing. Some people, they kind of use them interchangeably. The act of breathing and the exchange of oxygen and carbon dioxide from the air in or out of the lungs. So it's breathing in and out, that exchange. One respiration is in and out. Another respiration is in and out. So the way that this works best is if you can check their respirations when they don't necessarily know that you're checking it. Because otherwise, you know how it is. You, okay. You want to say hi to my class?
Hi.
Hi, Hannah.
Hey.
Oh.
All right. Okay, yes, you can eat that. So, anyway, so it works best when somebody doesn't know. Because, you get all nervous, like when the doctor's just staring at you to see what your heart rate is. It makes you kind of nervous. So, observation is probably the first way I would suggest to do this. And then auscultation would be second. So, hold on. The most common way to assess, like I said, is to observe chest movement. So for adults, it's like chest and shoulders. Obviously you're not just going to want to stare at everybody's chest, but chest and shoulders, watch it go up and down. That's one. Up and down again is two. And sometimes it's kind of hard to tell. Sometimes what I'll do is I'll actually put one hand on their wrist, like I'm still checking their pulse, and then I'll put one hand on their shoulder so I can kind of feel if their shoulders are moving too. That helps. Hannah, put that in the trash can, please. So that is observation. Children under 7, it's usually their abdomen that actually moves, and you'll see their little bellies go in and out, in and out. So abdominal breathing, that's what the ABD stands for down here. Abdominal breathing in older children and adults is actually dyspnea. Do y'all remember dyspnea, that word? Dys means?
Dys means far away or difficulty.
Yes, difficult, labored, bad. And PNEA is what? Breathing. So it's like bad or labored breathing, dyspnea. The rate is just, again, the number of complete breaths in a minute. So typically normal for adults is like 12 to 20, 12 to 24. You'll see that range change just a little bit depending on, who's seeing what the range is, but it's never less than 12. And usually I see like 12 to 20. But notice again, it's the same thing for respirations that is for pulse. So it starts faster and it gets slower as we get older. Babies breathe much, much faster than we do. If it's increased, then it can cause a couple of things. You have hyperventilation and tachypnea. So tachypnea would mean what?
Quick breathing?
Fast.
Yeah, fast or rapid breathing rate. Hypoventilation is low, so low oxygenation by, necessarily. And then bradypnea again is slow, so bradypnea would be slow breathing. Okay, then the rhythm, kind of similar to the heart, except obviously the rhythm, you don't have with heart rate, you've got lots of different types of arrhythmias that depending on the heart problem. With respirations, you do have lots of different types, but it's, there's not so much detail in it. But the pattern should just be regular and even. Breathe in, breathe out, breathe in, breathe out. But there are some abnormal ones. Cheyne-Stokes is one example, and this is where they have really irregular patterns. So they breathe really fast and then breathe really slow, or breathe really fast, breathe really slow. Apnea is not breathing. Remember, A means without. So without breathing is literally the meaning of that. But that's like some of you guys, your parents or grandparents or somebody may have sleep apnea, and they wear like a CPAP machine at night. Kind of looks like a Darth Vader looking mask. And that is because their airway closes on them while they're sleeping. And so what that machine does, that CPAP, actually it's called continuous positive airway pressure, and it opens up their airway so that it can let air through so it doesn't collapse on them at night. Agonal breathing is like end of life breathing. It is really almost like a gasping type of air, but it's not compatible with life. They can't live on agonal breaths for very long. They're very they might only have one breath every 15 or 20 seconds. And then Kussmaul's is a very specific type of breathing that is you typically see with somebody who's in a diabetic crisis. They're in what's called diabetic ketoacidosis, and so their diabetes, their blood sugar's gotten really high, and their blood has gotten really acidic. And this Kussmaul's is actually a mechanism of trying to make up for all of the acidity of their blood. They're trying to breathe off some of like the carbon dioxide so that their blood will get back to normal pH. I was just trying to give you some examples of some abnormal ones. Quality is seen in volume and effort. So basically it's like, is it shallow? Are they breathing shallow, or are they breathing deeply? So, a lot of times if people have been bedridden for a long time, they have pneumonia, those are some reasons somebody might be breathing shallow. If they sit down for a long period of time, that's shallow breathing. They're only using a little bit of their lungs. They're not necessarily like opening their lungs up really big so that they can get lots of air. And then deep breathing is taking really big, deep breaths. And then effort is observed by how the muscles are used. Sometimes when people are dyspneic, then they have what's called retractions, and you can see them up in their neck and in their ribs, kind of right below their collarbone. And every time they take in a breath, you'll see their skin kind of suck in. And that's because they're having to use so much muscle power to breathe, and that's not a good thing. That's usually a sign of advanced, respiratory issues. So the procedure, like I said, the easiest way to do this is if they don't know that you're doing it. So what I always do is I put my hand on their wrist, check their pulse for that first 30 seconds, count their number of beats, that's 30 seconds. And in the second 30 seconds of the minute, I count their respirations. But I leave my hand on their wrist so that they think I'm still checking their pulse and not checking their respirations. Tricky, I know. So I think that's the easiest way. Then they're not suspecting it, and they're not changing their breathing pattern just because you're counting. You don't have to do it that way. I think it'll just be easier. So again, check for 30 seconds, multiply it by 2. So look here, you count the complete breath of a patient, 30 seconds, and get 7. So what's their respiratory rate? 14. That one took y'all a long time. So yes, 14. Is that normal for an adult?
No.
No.
Yes. The respiratory rate is 12 to 24 is the normal for an adult. So 14 falls in that range. Okay. Last slide on here, and then you guys can go. Hold on a second. Okay, so oxygen. I'm having a meltdown now. So oxygen saturation is a measure of how much oxygen the blood is. Okay. I'll fix your I need 2 more minutes, okay? So, sometimes in the White House. Anyway, so oxygen saturation is a measure of how much oxygen the blood is carrying as a percentage of the maximum amount it could carry. So it gives you, y'all seen these, right? If you go to the emergency room or somewhere and they have this little alligator-looking clip and they put it on your finger, or sometimes it looks like a Band-Aid sticker and they put it on your fingernail and then wrap it around. Everybody seen those before? Stop. Has everybody seen those before?
Oh, yeah.
Okay. Well, we'll get them out. I have one there at the school. We'll get it out tomorrow. So it's abbreviated. 3-year-old meltdown here.
Hey, Miss Picker or Miss Bird, the bells aren't ringing and everyone got released, so everyone's banging on the door to come in.
Well,
go tend to that baby.
Let me just finish this one. So are they already gone?
Oh, they're gone.
Oh.
Yeah.
Okay.
Sorry. Because I have A&P kids coming in now.
Okay. I feel like that's way earlier than 2 or 3 minutes earlier than normal. But anyway. Okay, well I'll just finish tomorrow.
Okay.
All right. If you'll sign out, I'll finish for my online kiddos. So.
Yes, ma'am.
Okay, so let me finish for you guys. So how much oxygen the blood is carrying as a percentage of the maximum amount it can carry. So it's abbreviated SpO2, and it's a really good indicator of respiratory status. So this one gives such good info as far as how good their respiratory status is. I mean, it just, I don't know, it gives us an idea of how oxygenated they really are. This is much more specific and much easier to make diagnoses off of than just the respiratory rate. So less than 88% is too low for an adult, and the physician needs to be notified. They probably need oxygen. And for kids, it's 90%. So they would probably need oxygen. The machine itself is called a pulse oximeter, and it's usually assessed on like a fingernail or an earlobe is where we usually see that. So again, a really great tool. It's really considered a vital sign at this point. I mean, most people take it every time they take vital signs. So anyways, great thing. We'll practice this tomorrow. You guys have a good rest of the day.